So, my healthcare promotions project is over preventing pregnancy complications and improving women's health and the mortality rates before, during, and after pregnancy. And this is by increasing the proportion of women who receive early and adequate prenatal care. So, some causes of not having access to prenatal care is limited or lack of access to maternity leave, financial and insurance burdens, drinking or smoking while pregnant, being a single parent, and minority groups. And some risk factors that can come from not receiving this care are increased need for C-section, harm to mother or baby, and the possibility of early or late birth. Some statistics coming from this topic are, according to the CDC, 76.4% of pregnant women received early and adequate prenatal care, and the goal on their website for 2030 is to have this percentage be up to 80.3%. The incidence rate is 1 in 5 women are unable to have a prompt prenatal visit, and the prevalence is about 10% of women have never had a prenatal care visit, and this results in a lack of necessary knowledge about the woman's pregnancy. Another big factor is to know who's at risk. So some modifiable risks are smoking and drinking during pregnancy and having children at a very young or very old age. Very young would be about 15, 16, and very old would be late 30s, early 40s. And some non-modifiable risks are pre-existing health issues, low income, having previous children, having a previous C-section, genetic conditions, and being pregnant with multiple babies at a time, like twins or triplets. So without the use of insurance, there's ways that you can improve your pregnancy at home, which are looking for ways to apply to Medicare and Medicaid, making sure you receive proper nutrition, taking over-the-counter prenatal vitamins daily that you can find at your pharmacy, developing a birth plan, and remember you're not alone. Reach out to family, friends, and healthcare providers for help and advice. And if you do have access to insurance and healthcare, make sure to contact your doctor as soon as you find out you're pregnant, attend your appointments, be up to date on your vaccines, ask your healthcare provider questions, and let them know of any complaints you have, and keep your doctor in the loop of any concerns you may have. So these are some early symptoms and signs of pregnancy, and they usually start 6 to 8 weeks after conception. They are nausea, morning sickness, breast tenderness, delayed menstruation, fatigue, spotting and cramping, frequent urination, bloating and constipation, and cravings and food aversions. These are some additional resources that I found. So some local ones here in Bowling Green are Med Center Health, and you have a one-time payment of $10 with free screenings. And also TriStar Greenview Regional have screening services that may require insurance. And some in the state, there's Lexington and Nashville have great hospitals with women's care, such as Centennial Tennessee Women's Care and Baptist Health in Lexington. And on the national scale, the website for the Women's Health Alliance provides great resources for real members that are actually nurse practitioners, and I link the website at the bottom. And these are the references that I used for my presentation. Thank you.